Hello everyone and welcome to Meet the Joint, Elbow, part of the National Hemophilia Foundation's Make Your Move Physical Therapy webinar series. This series is supported by a cooperative agreement from the Center for Disease Control and Prevention. Our presenter today is Debbie Voss. Welcome, Debbie.
Thank you.
Debbie Voss, PT, DPT, ATC, CS, has been a physical therapist for over 20 years and has worked in the bleeding disorders community since 2006. While a physical therapist at the Hemophilia Center of Western Pennsylvania, she was actively involved in Camp Hot to Clot, the Western Pennsylvania camp for children affected by bleeding. In addition to being a licensed physical therapist, she is also a certified athletic trainer and holds certification as a strength and conditioning specialist. After the presentation, please click on the web page link to fill out our evaluation. Your valuable input will help us better define programs for the future. The PowerPoint presentation will be available as a handout in the future. For more information, be sure to visit www.hemophilia.org or www.stepsforliving.hemophilia.org. Without further ado, I will now turn things over to Debbie.
Thank you very much, and it's my pleasure to be here. And welcome and thank you to anyone who is participating in this webinar today. As the title suggests, we're going to learn a little bit about the elbow joint. So as we're getting started, I want you just to think for a minute about all the ways that you use your hand in the typical day and all of the things that your hand touches throughout the day. Part of the ability of your hand to engage with the environment and also to take care of you is due in part to the functions of the elbow, because the elbow's primary function is to be able to position the hand in space to do things. And we know that the elbow is the site of the greatest number of bleeds in the upper body. Just as the ankle and the knee see the most bleeds in the lower body, the elbow is the joint that tends to bleed the most in the upper body. So objectives of our webinar today include going over some basic elbow joint anatomy and then also movements that occur at the elbow joint. We're going to look at both some of the short-term and the long-term effects that bleeds have at the elbow joint. And then we'll also discuss some treatments that help to protect the elbow joint health and function over the long term. So starting with some basic elbow anatomy. When we look at the bones that make up the elbow joint, we're talking about three bones. First, there is the humerus, which is the upper arm bone. And then there are two bones within the forearm called the radius, which sits on the thumb side of the forearm, and the ulna, which sits on the pinky side of the forearm. The humerus itself forms a hinge joint with the ulna that allows bending and straightening at the elbow, and then the radius tends to rotate over the ulna to allow positioning of the hand. If we look at this drawing that shows sort of a cutaway from the joint itself, we see that covering the ends of the bone is what is called articular cartilage. And articular cartilage is a smooth surface that allows the bones to glide gently over one another and also provides protection for the ends of the bones. Surrounding the entire area where the bones come together is what is called the joint capsule, and that's sort of an envelope that surrounds this entire area. Within that joint capsule is a liquid called synovial fluid, which provides not only lubrication, but also nutrition to the joint. And then on the inside of that joint capsule is a thin, smooth surface of cells that's called the synovium. And it's the responsibility of that synovium that lines the joint capsule to keep the inside environment of the joint healthy. So if we take a step farther outside of the joint itself, we look at some of the muscle anatomy that affects the forearm. In the upper arm, we have a muscle group that sits on the front of the upper arm called the biceps group, and that is the muscle group that's responsible for bending the elbow. And on the back of the upper arm are the tricep muscles, which are responsible for straightening the elbow. If we look farther down into the forearm, we have the supinator and the pronator muscles, and they are responsible for rotating the radius over the ulna to position the hand in a palm up or palm down position. I also want to mention there are other muscles that cross the elbow, but they do not directly affect movement at the elbow. They actually attach farther down across the wrist and the hand to allow the hand to position. So when we look at typical movements that happen at the elbow joint, we're talking about 4 different movements. The first of these is what we call elbow flexion, and that's just the name that we give to bending the elbow. Again, that hinge joint that's formed between the humerus and the ulna, as the elbow bends, it allows the hand to come up toward the face or the head. And these are important movements to be able to take part in feeding activities, to be able to groom, such as brushing our teeth or brushing our hair, and also, as you see in this photograph, being able to hold the phone up to your ear when you're talking on the phone. The woman's able to do that because she has full elbow flexion or full elbow bending allowed at that elbow joint. The opposite movement to elbow flexion is what we call elbow extension, and that means straightening the elbow. And full elbow extension allows the elbow to go all the way straight. And that's important for reaching for objects, not only away from our body forward, but maybe overhead. And doing things like dressing, putting on our shoes and socks, it's important to have a good degree of elbow extension to allow us to do those activities independently. Now if we look more in the forearm where the radius moves over the ulna, there's a movement that's called elbow pronation. And that's a movement that allows the hand to get into a palm down position. Just as you see in this photograph, the gentleman has his hands resting on the keyboard. In order to be able to use a keyboard or to place the hands flat on a desk surface, that forearm must be able to have a good pronation range of motion. It's important for not only things like that are shown here, but being able to pick up objects from a flat surface and also using a knife to cut your food. The opposite movement to elbow pronation is looking at supination, and that is rotation of the radius over the ulna to move the hand into a palm up position. As you can see, the young cashier here has his hand in a palm up position and he has coins resting in the palm of his hand. In order to be able to hold things in the open palm, full supination is very important, and it's also functionally important because it allows us to bring food to the mouth to be able to eat. All right, so now let's look at some of the effects of joint bleeds. And I would imagine that some of this is review because a lot of joint bleed outcomes are similar for many of the joints in the body, but there are some unique characteristics within the elbow joint. So we know that during an active joint bleed, blood starts to fill that space, that joint capsule, right, that's normally filled with a synovial fluid. And blood is not a naturally occurring substance within that joint capsule, so it starts to create pain and a lot of swelling because there's more fluid within that joint. Because of that increased fluid within the joint, it can lead to joint stiffness and then also start to limit the amount of motion available at that joint. During an active joint bleed, the joint may actually feel warm to the touch as well. Once you recognize that there is bleeding happening within that joint, it's very important to infuse factor to try to get that bleeding to stop. The synovium, remember that inside lining of the joint capsule that's responsible for keeping the inside of the joint healthy, starts to work because it recognizes, wait a minute, there's something in here, this blood, which doesn't belong here. So it tries to start cleaning up the joint to get rid of that blood. The blood also can start to cause problems to the cartilage, that material that covers the ends of the bones, and can actually start to cause some of the cartilage cells to die away. So this is what happens during a typical single joint bleed. So what happens if we start to get repeated joint bleeds within that same joint? Well, that synovium, that inside lining of the joint capsule, it's almost like it starts to work overtime because it says, wait a minute, I need to clean up this area because there's blood in here, and it continues to grow and get thickened and get very irregular, trying to do its job to maintain a healthy environment within the joint. When that synovium becomes overgrown and irritated, that's what we term synovitis, which simply means an inflammation of that synovial tissue. You may start to notice in a joint that has had repeated bleeds like that, the joint may start to look swollen all of the time, even if there is not a bleed or if there's no pain. And that's just because that synovial tissue has become very thickened within that joint. Part of the problem that happens with that excess synovial tissue is as the joint moves doing its normal day-to-day activities, sometimes that excess tissue can get pinched between the bones, and that pinching actually causes more bleeding within the joint. So if all of a sudden you have a joint bleed and the synovium becomes overgrown and gets irritated trying to clean up that joint, And then that overgrown tissue gets pinched and leads to more bleeding, which then leads to the synovial tissue again trying to clean up the joint. Many times people can get stuck in this cycle of repeated bleeds that may be very challenging to get out of. If we look at long-term effects of elbow joint bleeds, and this can develop over many years or even decades, we know that the joint starts to change significantly. The joint may become deformed. There may also be muscle wasting that we call atrophy of the muscles. And then you may start to develop overuse of other joints, perhaps the wrist or the shoulder on the same side as the involved elbow, or even the other elbow. And the reason for that is if the involved elbow can't do what it's supposed to functionally, the other joints have to take up some of the slack, and sometimes they could develop problems because they're doing more than they were intended to. These joint changes that happen over years after repeated bleeds are what we call hemophilic arthropathy. And that phrase simply means there is damage to the joint that has happened in response to bleeding within the joints. And again, the long-term consequences of having bleeding within that joint can be breakdown of the cartilage that covers the ends of the bones. The bones themselves can start to change in that they become overgrown or misshapen. And that normal space that happens between the bones that allows movement may start to collapse. So there's even less movement, and it can also cause pain. One of the things that's unique to the elbow joint can be nerve damage that results as some of these changes happen. There is a nerve that sits along the back inside part of our elbow called the ulnar nerve, although you may know it better as your funny bone. If you've ever heard someone talk about hitting their funny bone or you've done that, what that means is causing injury or trauma to that nerve. You may feel pain that goes down the forearm or into the hand. You may feel some tingling. Those are things that typically happen when we have an injury to that ulnar nerve. Well, as bony changes happen within that joint with repeated bleeds, sometimes the groove where that ulnar nerve runs on the back of the elbow can start to develop spurs and close down on the ulnar nerve and creates problems within that nerve. Early on, that might feel like pain or tingling into the hand and the little finger and the ring finger. Over time, that may actually lead to a loss of sensation in those fingers and weakness of the muscles within the hand. So now what can we do to try to preserve long-term joint health and function of the arm? First and foremost, the best way to protect your joint is to prevent bleeds, right? I think we all know this. Bleeding causes damage, so in order to protect the joint, we want to prevent bleeds. So if that means that you and your doctor have talked about a prophy program for you, it's very important to stick with that prophy program as it has been advised. Now, let's say you're doing everything that you're supposed to with that regular prophy program, but you still develop problems with bleeds. That's the time to call your doctor and talk with him or her, because maybe there need to be some changes to your prophy program, or there may be some other issues going on that the doctor needs to check out. Just as with other joints within the body and the body as a whole, regular exercise is very important for overall health and wellness. Within the joints, doing regular exercises help to maintain joint motion and keeps those muscles strong to help to support the elbow joint. And then finally, a way to prevent bleeds is to avoid high-risk activities. And high-risk activities are those that typically are associated with increased risk of injury or trauma, or injuries that can result from overuse of the arm. And you may be wondering, what exactly does overuse of the arm mean? Well, here's an example. Let's say that you like to play tennis, but it's been a long, cold winter and you haven't been out to play tennis all winter long. So spring comes around and it's a nice, warm, sunny day, and you decide that you're going to go out and play tennis. Well, as a physical therapist, I want people to work slowly and gradually to get into activities to try to condition the joints and the muscles to get used to that activity. Well, instead of going out and maybe volleying the ball for 15 or 20 minutes as an early conditioning exercise for that elbow, it's a nice day and you've missed tennis and you go out and you play for 4 hours straight. If that happens, you have definitely overused that arm and it's likely to lead to injury and a bleed. Again, I would expect that this is review information, but as soon as you recognize that there is a joint bleed, it's very important to infuse factor, as your doctor has recommended, to try to get that bleeding to stop. Once you've infused factor, if it's helpful, you can also use RICE, R-I-C-E, which stands for rest, ice, compression, and elevation. So rest is exactly as it describes. If you're having a bleed in the elbow joint, I don't want you to use that arm. I don't want you to lift with it. I don't want you to do activities with it. We want to let that area calm down to get the bleeding to stop. You may even need to use something like an arm sling to help to support and control movement within that elbow for a short period of time. The I stands for icing, and I recognize that recently there's been some controversy as to whether or not to use ice. Ice can help with pain control during a bleed. Typically putting it on for 10-15 minutes every few hours can help to numb the area and decrease pain. However, if at any time you feel like that ice is making the bleed worse or the swelling worse or the pain worse, stop using the ice. Compression simply means using a light elastic wrap around the elbow to help to support it, and it can also decrease the amount of swelling then that can happen within that joint because of the bleeding. And then finally, the E stands for elevation, and elevation means getting that joint above the level of the heart. So if we're talking about an elbow joint bleed where there's swelling, it might mean laying on the couch or laying in bed with that arm propped up on pillows to get the joint above the level of the heart. Once the bleeding has stopped within that joint, it's okay to start to gradually resume the use of the arm. And gradually is the key word here. You don't want to jump right back into activities because we don't want to risk having another joint bleed, but gradually increasing your activity to get back to normal is what we encourage. So some early exercises that your physical therapist might talk about at this time include active range of motion exercises or isometric strengthening exercises. And then as the joint continues to get better after that bleed, the physical therapist may mention some stretching exercises or some isotonic strengthening exercises. And we're going to talk about specifics of what these exercises look like. So first, active range of motion exercises. The name describes exactly what you're doing. You are actively or purposely using your muscles to move that joint. And here's an example of active range of motion exercises for the elbow bending and straightening or flexing and extending. So in this picture, the model is sitting relaxed and slow controlled. She's going to try to bend her elbow to bring her hand toward her shoulder, and then slow controlled, she's going to allow it to straighten back down. Working on these gentle active range of motion exercises helps to decrease some of the stiffness within the joint, helps to lubricate the joint, and also keep the joint nourished. There are also active range of motion exercises for the forearm, or that movement where the radius moves over the ulna in that supination and pronation motion. Again, looking at the model here, she has her upper arm next to her body with her elbow tucked in next to her waist. And in a slow controlled manner, she's rotating her palm from a palm up to a palm down position to try to gently move that joint to decrease some stiffness. Isometric exercises are a very gentle way to keep the muscles active. It's a way to set the muscles or to get them to contract without creating a lot of movement around the joint. And the picture here shows using isometric elbow extension and isometric elbow flexion to keep the triceps and the bicep muscles active. So hopefully that will decrease the risk of them wasting away or atrophying. So again, for this model, we're looking at the left elbow is the one that we're working. If we look at isometric elbow extension, she has a fist in her left hand. Again, that's the arm that's working. And she places her right hand under the left fist. So the right hand acts as sort of her resistance, or as I like to say it, like a brick wall. It's not going to move. And she's going to take her left fist and try to push it down into her right hand. And when she does that, her tricep muscles, the muscles on the back of her arm, are going to contract and gently stay active. The opposite side of that, in order to work the bicep muscles, the muscles on the front of the upper arm, she's simply going to change her right hand position to the top of the left fist. Again, the right hand is sort of acting as the brick wall or the non-moving force, as she then pulls her left hand, or her left fist into her right hand to get the bicep muscles to contract. There are also isometric exercises for the forearm, for the pronator and supinator muscles. Again, in this particular image, the left hand is the one that's doing the work. So supporting the forearm on a table, the right palm is going to meet the left palm and is going to resist as the left palm tries to turn into a palm down position. And that is what's going to activate those pronator muscles to help to keep them active and try to keep them from wasting away. The bottom image shows resisted isometric supination. The right hand position changes just to cradle the left forearm and hold it in place, while the left palm tries to turn into a palm up position with the right hand resisting it to keep the supinator muscle active. So once you've gone through some of those early exercises and the elbow continues to improve, if there are issues with maybe the elbow doesn't straighten quite as much as it did before, or you're having difficulty getting into that palm up or supination position, the physical therapist may recommend some very gentle stretching exercises. And this image shows a gentle stretch just using gravity as the resistance to try to stretch out the tissues. Now, for this exercise, and really any of the exercises that I'm talking about, they should not cause pain. If they cause pain, stop the exercise and talk to the physical therapist. It may be that either you're trying to do the exercise too aggressively, or maybe it's just not the right exercise at the right time for you. But to gently work on some stretching, this young lady is laying back with a towel roll under her elbow, which just helps to support the arm. And then she's just relaxing and let gravity gently stretch out the tissues to try to gain a little more motion within the elbow. And lastly, we're going to talk about some isotonic strengthening exercises. Now, these are the typical exercises that we think of when we think of strengthening exercises to get the muscles stronger. So we typically use an external resistance. It might be a dumbbell, it might be a can of food, it might be a bottle of water, but there's some sort of external resistance that we are moving in order to get the muscles active and to try to get them stronger. This gentleman is showing an exercise using a dumbbell, trying to get his biceps stronger, those muscles on the front of the upper arm. So he's holding the weight and slow controlled. He's going to bring that weight up toward his shoulder, and then slowly he's going to lower that weight back down. And repeatedly doing that is going to work the biceps muscles and try to get them stronger. The opposite of this is working on the tricep muscles, the muscles on the back of the upper arm. In this case, the individual is laying back and holding the dumbbell in her left hand. Her right hand is simply supporting the left upper arm. Slow and controlled, she's going to bend the elbow to bring the weight next to her ear, and then slowly she's going to try to straighten the elbow to take the weight up toward the ceiling. That again will work the tricep muscles to try to get them strong. Now, with this particular exercise, I always caution people because it makes me a little bit nervous when people are laying back and they have a heavy weight above their head, right? Last thing I want to have happen is lose control of the weight or drop the weight and have another injury. That would not be good at all. So I always make sure that people understand, A, make sure you start with a light weight that you can easily control. You don't want to start with anything that's too heavy. And B, it's a good idea to always have someone spotting you during this exercise. And spotting means somebody standing, moving their hand perhaps just below the weight to help you to control it in case you decide that you need some help. Then there are also isotonic strengthening exercises for the forearm muscles, the pronators and the supinator. You can still use a dumbbell for this, but instead of grabbing the dumbbell in the center like you do for the other exercises, you want to grab one end to offset the weight just a bit. So as you hold that dumbbell on the end, slow and controlled, you're going to rotate palm up and then palm down to work on strengthening those pronator and supinator muscles. All right, so what happens if we develop some long-term joint issues? There are some things that we can work on to still try to maximize the health and function of the elbow joint. And these can include physical therapy as a formal course, braces and devices, and last but not least, surgery. So physical therapy, if you go to a hemophilia treatment center and you meet with a physical therapist, you know that we love to measure joints. You've probably seen a device like is shown in this picture. We do this year to year or visit to visit to make sure that you're maintaining joint motion over time. And if we start to see that there may be problems with that joint losing motion or stiffening, we may talk about certain exercises that you can work on to try to regain some of that lost motion. Physical therapists are also great resources to talk about ways to control pain. If there's pain during an acute bleed or long-term pain because of some hemophilic arthropathy issues, talk with the physical therapist about some possible techniques. And then finally, PTs can also make some suggestions about other things to do, other devices to use to try to preserve your joint health and still allow you to be functional. Some things that the physical therapist might recommend include some of these braces or devices. I've shown 3 here that may be indicated to help someone to maintain function with their elbow. So the top picture is something that's called a reacher. So you see sort of this alligator clip on the end of this device, and it's sort of triggered by moving the fingers. And this can allow someone to pick up light objects at a distance, maybe off of the floor or on a shelf in front of them. So if someone maybe does not have full extension or straightening of the elbow, they may need to use a device like this to be able to reach objects more easily. The bottom left picture shows what is called a dynamic brace. And this is designed when there has been tightness within the elbow joint and we're looking to try to stretch out some of the tissues very gradually. The hinge within this joint is spring-loaded, so when people wear it, it provides this low-level, long-term stretch to the tissues to try to get them to stretch out a little bit to allow more motion at the elbow. Now, I will say with this particular brace, Sometimes it can be very cumbersome because when you use it, you have to wear it for many hours at a time and wear it for many weeks in order to see some benefit at the elbow. Some people find, it's hard to find the time to do it. It's not always the most comfortable. So if you decide to try a brace like this, you really need to be dedicated to use it for the time of period that is recommended to see benefits to the elbow. Last but not least on this slide is the picture on the bottom right. And the device that you see here is called a heel bow. And it's just simply a slip-on little elastic sleeve, but as you may be able to see toward the back, there is padding that's built into this elbow sleeve. So if you remember before when I talked about the ulnar nerve or hitting your funny bone, because that nerve sits very close to the surface of the skin, sometimes if people have irritation to that nerve, they may wear something like this heel bow to try to protect the joint or protect the nerve from getting hit, which can cause further pain. So last but not least, let's talk about surgery. And the reason I say last but not least is really we would like to try to keep the elbow joint healthy without having to get to this point of surgery. However, if the situation is such that we've gotten to this point, there are still some surgical techniques that can try to preserve as much function as possible for you and to decrease pain at the elbow joint. So the 4 things that I would like to cover include a synovectomy, a radial head excision, a joint replacement, and a joint fusion. So a synovectomy procedure simply means cutting out excess synovial tissue. So remember when we talked about repeated bleeds, that synovial tissue starts to thicken and get irregular and take up a lot of space within that joint. There are some different techniques that a surgeon can do to go in and remove that excess tissue to try to break up that repeated bleed and synovial tissue irritation cycle. One of the ways this can be done is through the technique that's shown in the picture through an arthroscopic synovectomy. And what that simply means is the surgeon makes small incisions into the joint and then puts these instruments into the joint, one of which is a tiny camera. So the surgeon can look at a monitor to see what that camera is seeing inside of the joint. Some of the other instruments may include tools that can help to cut away or take out some of that excess synovial tissue. And again, this is designed to be used when the body has gotten into that repeated bleed cycle and it's been hard to get out of it using a prophy program alone. Then there is a technique called a radial head excision. So you see 2 images here, sort of an A and a B here, and this is sort of the before and this is the after the radial head excision. So as I had mentioned, when there are repeated bleeds, sometimes the bones tend to be overgrown. So what we're looking at here, this triangular shaped bone here is the end of the humerus, the upper arm bone. This bone here toward the right is the ulna, which forms sort of that hinge joint in the elbow. And this bone is the radius. And this end of the bone that's sort of T-shaped is what we call the radial head. Well, with repeated bleeds, that radial head can get overgrown and can start to limit the amount of palm up, palm down position or rotation that can happen in the forearm. The surgeon can go in and, as this B picture shows, actually take out that radial head. Taking out that radial head allows more palm up, palm down positioning to happen with the hand and can improve someone's function. Now, just because they cut out part of that bone, I don't want you to think, oh my gosh, all of a sudden I have an unstable elbow. There are a lot of other tissues that help to support this area, so really there isn't much of a loss of stability at all within the elbow, but there can be a huge decrease in the pain and a huge increase in the amount of palm up, palm down positioning that a person can have. I do want to mention that there are techniques for an elbow joint replacement. Now you may have heard of joint replacements when people talk about the knees or the hips or maybe even the ankles, but there is an option for an elbow joint replacement as well. Pain is the biggest indication to do a surgery like this when there's so much degeneration and breakdown of the ends of the bones that it causes pain, and people tend to not want to use the arm because there is so much pain. The surgeon can go in and remove the diseased ends of the bones and replace that joint with an artificial joint. Now, while this can be an option for a joint that has a lot of damage, it may not be one of the better surgical options for someone who has hemophilia. If you're someone, let's say in your 80s, and you have a diseased elbow joint and you don't tend to be real active and you don't do a lot of activity, an elbow joint replacement might be a good option. And the reason for that is once you have this surgery, the surgeon may say, okay, for the rest of your life, you cannot lift more than 5 pounds with that arm. And again, if you're pretty sedentary, if you don't do a whole lot of activities, 5-pound lifting restriction for the rest of your life may be an okay trade-off for not having the pain. However, if you're in your 30s or 40s or 50s and you're active and you have a job or you have kids and you're doing a lot of activities, a 5-pound lifting restriction for the rest of your life may not be very reasonable. So again, this can be an option for people, but it may not be one of the better options for people who have hemophilia. Last but not least, there's an elbow joint fusion. And again, biggest indication for this is severe pain because there's been breakdown within that joint surface, and people tend to stop using the joint because it is so painful. What the surgeon will do with this is actually put bony material into the joint space and allow it to heal. So once that bone heals, there will no longer be any movement of bending and straightening the elbow, so it takes care of the pain. And really, this can be a pretty strong joint that you can then lift things with your hand because it's a bony cross in the joint. It doesn't create movement, and it's a pretty stable joint after the fact. So even though you may lose any available motion that you have at that time, because there's no longer pain in there, you may actually find that you can do more with that arm than you did before. All right, so just to review some of the importance of the elbow joint. Elbow is very important because in people who have bleeding disorders, it is the most frequent site of bleeds that happens in the upper body. So we need to recognize and appropriately treat those when they happen. And the primary importance of the elbow joint is to be able to position the hand. We use our hand all day long for engaging with our environment, doing things out there, taking care of ourselves with feeding activities and grooming activities. So maintaining good elbow joint health is important to allow us to continue to do those things. Bleeding in the elbow joint, as well as other joints within the body, can cause some immediate and some long-term changes within that joint that may not be reversible. And preventing bleeds is the #1 best way to try to maintain long-term joint health within the elbow. Here are some of the references that were used in developing this webinar, and there's some great information in these if you're looking for further information on the elbow. Thank you very much for participating in this webinar today. I hope that there has been some great review of information that maybe you've known in the past, but also some new information to try to give you an appreciation for the importance of the elbow joint. Thank you.
Thank you, Debbie. And ladies and gentlemen, your feedback is critical to us, not only in evaluating this presentation, but also in planning future webinars and programming. Please complete a 2-minute evaluation survey on the webpage. We thank you for attending, and this concludes the program.